or should we? Hi, good evening, everybody. My name is Eileen, and I'm the Associate Director for Future Students in the Faculty of Medicine, Dentistry, and Health Sciences. So today I'm just going to show you a short excerpt of a video that is actually presented by the course coordinator for the Doctor of Dental Surgery, as well as a student who's actually sharing about her experience. So we can take on more questions later on. And also, if you have more questions, just please pop into the chat room and come and have a chat with me and my colleagues. So I'm just going to share the screen now, and we'll play the video.
We are located very conveniently at the edge of the city. As you know, Melbourne is a beautiful city to live in. We have been voted the most livable city for several years. And being close to the edge of the city, close to public transport, there is a lot of student-friendly city accommodation available. We are also located within the Royal Dental Hospital of Melbourne. So the Melbourne Dental School is within the hospital. And so we have access to the clinics, to patients, to staff, to nurses. So you'll be spending all 4 years within the dental hospital, and also at a preclinical training laboratory called the Melbourne Oral Health Teaching and Education Centre, which is a stone's throw from the dental hospital. We are an established program. We began in the late 19th century, so we have well over 100 years of established program. It is since 2011, a graduate entry 4-year program. You will require equivalent of second-year physio, biochemistry, and anatomy as a selection criteria for the course. We accept approximately 100 odd students into first year. So the course in first year is a lot of didactic, a lot of preclinical. So the benefit of the graduate program, as opposed to a Bachelor of Dental Science program that we used to have, is the fact that you are starting to cut plastic teeth literally within a few months of starting first year. So you have a good idea of what it is going to be a dentist very early on to shape your decision. We also have very experienced teaching staff. So alongside the Doctor of Dental Surgery program, we have a Doctor of Clinical Dentistry, which is a specialist in training program. So we have access to specialist staff like myself. We also have private general practitioners and private specialists from the city and around metropolitan who come in to commit their time to mentoring and contributing to our teaching program. And so we're very, very fortunate. Also, Royal Dental Hospital is the largest public clinic within Victoria and houses the only public specialist clinics within Victoria. So we get a lot of referrals from Victoria into the hospital, and we are able to divert patients into the student clinic, whether it be the preparation for practice or the specialist in training program. So we're very, very fortunate that way. So the Melbourne Oral Health Teaching and Education Centre, or MOTEC as we call it, is a state-of-the-art 49-chair preclinical that allows you to have the preclinical education to get you competent and confident before you enter the clinic. We do start clinical experience in second year, and this is where we are quite unique. Not all dental schools will start you in the clinics from the second year out of a 4-year program. As you progress in third year and fourth year, your clinical experience and engagement increases, and in fourth year, you are completely in the clinic for the teaching weeks. So the clinical experience that we provide you from second year is mainly at Royal Dental Hospital of Melbourne. And then following that, in final year, you will have experience in metropolitan clinics, in rural experience in Shepparton and in Morwee. And you will also receive a private practice experience. And this is where we are also unique, and certainly a positive a plus when you are actually seeking employment following graduation. You receive experience in obtaining financial consent, which is quite different and really important in being a dental practitioner. And that occurs in Melbourne Dental Clinic, which is a stone's throw from the dental hospital and located within Motet. So what are your graduate outcomes and what are your opportunities in your career? We would encourage our new graduates to have both public and private experience when they first graduate. You certainly can open your own practice immediately. It's not something that we would encourage. Our degree is recognized in all of Australia, New Zealand, and also in Canada. So you need to sit one additional Canadian Dental Board exam, but otherwise you can actually practice in all of those countries. You can choose to have a career in public health and advocate for that, and you know, be embedded within politics. You can choose to have a career in research and academia, which is what we do at the Melbourne Dental School as academic staff, or a combination. So as I mentioned before, we have a lot of private practitioners that come and contribute to the school and have a little bit of teaching commitment within their week. So just some information about the applications and useful links that you will have, and it's available to you. And I would like to thank you for your attention. I'd like to introduce you to Lucinda, who will share her experience as a student in the DDS program. Thank you.
Thank you, Dr. Wong. So again, my name's Lucinda, and I'm in my final year of the DDS program. So a little bit about me. I grew up in rural New South Wales, one of the last local council areas in Australia without water fluoridation, which when you get into dental school, you'll realise is a pretty big deal. I remember my childhood dentist telling me what a big impact providing water fluoridation to that community could have, and it really sparked an interest in me for oral health education. So I was really lucky though that I actually enjoyed going to the dentist when I was young, and my dentist really encouraged me to investigate what it might take to become a dentist myself. So I took a gap year after I finished high school, and then moved to Melbourne and did my undergraduate degree at Melbourne University. I graduated in 2017 with a Bachelor of Science and a major in physiology. In my second year of undergrad, I was actually lucky enough to start working at a private clinic. And I really fell in love with the dental profession there. I discovered that dentistry is a really amazing mix of different things. You've got science, medicine, art, engineering, psychology, just as a few examples. So I studied really hard in my second and third year, and I sat the GAMSAT twice, and I was lucky enough to be offered a place at both Sydney University and Melbourne University, and I chose Melbourne Dental School. I think one of the main reasons that people do have a preference for Melbourne Dental School, as Dr. Wong touched on earlier, is the clinical exposure. So in the DDS program, you actually start seeing patients at the beginning of your second year, and your clinical exposure just increases exponentially from there. So when you move into your third year, the focus is really on specialty clinics. So again, Dr. Wong touched on the fact that we have access to such an amazing array of different specialists. And so in third year, roughly half of your contact time is clinical work, and the supervision is by specialists. So people who have done or are in the process of doing additional degrees to just focus on one aspect of dentistry. And that could be root canal treatments or gum disease or prosthodontic work like crowns and bridges. So in my final year, and I've been really lucky over the last 3 and a bit years to be really heavily involved in representing my cohort to the school as a class representative. So leadership and student representation has been a big personal focus of mine, but several of my friends have been focused more on the sort of social aspect of things as members of the executive committee for the Melbourne Dental Students Society, which represents all of the dental students to the school and to the university. and they do a really wonderful job of regularly organizing social events, along with like Q&A sessions on different experienced dentists on different topics. So there's really lots of different things from the social side to become involved with if that's what you want to do. What is it really like to be a dental student? It's a big question to answer. Last year was pretty tough, but we were able to make up some of our clinical experience earlier this year. And 1 week from February really stood out to me. It was a week where I finished my first root canal, I placed my first sutures, I inserted my first crown, and to top off that week, I had a pediatric patient, a 13-year-old girl who I did a filling for in front of one of her front teeth. And she said to me at the end of the appointment when I handed her the mirror, "I can finally smile in my school photos now." And to me, that just rounded out what was already an incredible week, but really reinforced just what a wonderful profession dentistry is and how much of a big impact you can have on someone's life. So now in my final year, we're essentially just basically working full time with patients, fully supervised by dentists, but we are Monday to Friday, 9 to 5. So we have 9 4-week rotations this year, either at community clinics or at the dental hospital or at the Melbourne Dental Clinic. So yeah, the dental school has really great relationships with the DHSV, which is Dental Health Services Victoria. And that means that our placements are not just in metropolitan Melbourne, but also rural Victoria. And they're some of the best experiences that the students that I've spoken to previously have had. I'm going in July to Shepparton for 4 weeks, and I'm really, really excited. One of the biggest concerns that I had before I started dental school was how hard is it going to be? And I've learned through my own experience and through talking with friends that that's, again, another difficult question to answer, because it's going to be different for everyone. People are going to find different things difficult. Personally, I struggled with the didactic learning in first and second year. They were the hardest 2 years for me. You're attending a lot of lectures, you're constantly taking in new information, and then trying to apply that information to more simulated experiences. But now that I've moved into 4th year, I found 3rd and 4th year much easier. It's really, really enjoyable. You're applying the knowledge that you've gained and using your hands to really make a difference to someone's life. One of the things I definitely wasn't prepared for is how physically demanding dentistry is. But I think that just means that you really have to put some time aside to look after yourself, which is actually really a good thing. So finding a physical activity or a hobby that you really love that gets you up and moving and keeps you fit and healthy. And what's the time commitment like? That's also a really good question. Every year is different because the focus is different. First year is about 30-ish contact hours a week. And then on average, on top of that, I was probably doing 10 to 20 hours of self-guided study. And that does increase a lot around tests and exam time. But as the years go on, you've got less new content, but you've got a lot more revision to do, because they will tell you when you start that every piece of information they give you is important, and that could not be more true. It's just finding out the specific situation that that piece of information is relevant for. So dental school is probably the hardest thing I've ever done, and I'm continuing to do, but it's definitely been the most rewarding. I really love dentistry. I love seeing, treating and building relationships with patients, and I really love helping people. I think the Melbourne Dental School has really allowed me to create some wonderful professional relationships as well, from a really wide variety of different people. And I think that that's going to be a really valuable resource to me for the rest of my career. So I hope that I've given you a little bit of an insight into what it's like to be a dental student, but if you have any more questions, please let us know.
Oh, you're on mute.
Oh, sorry. Yes, thank you, everybody. I think we're just about on the dot for our timing. And so if you have more questions, please feel free to come into the chat room, and we can continue our conversation there. All right, back to you, Molly.
Awesome. Thank you, Aileen. It's been nice to see you, and we appreciate you doing a presentation tonight. So like Aileen said, if you can head back to the chat, You can ask any questions there and they're happy to help.
Right.
Thank you. Thanks for coming and helping us out.
Bye.
Bye.